Thank you for coming to this the Stanford Conference on Pandemic Management. I am delighted to introduce President John Levin, who's going to be giving the opening remarks. And I just very briefly, I'm so grateful to each and every one of you that have come. This is going to be an amazing event where we are going to talk to each other in a civil way and learn from each other. And it is going to be an incredible day. President Levin, thank you for coming. Thank you for talking. Please, a round of applause.
Okay, good morning and welcome to everyone. I appreciate the opportunity to be here. Now you might wonder, why is John Levin opening this conference on pandemic policy? You might say, John is not a public health expert. And of course I might say, well, I did run a business school during the COVID pandemic. So I do have some experience making COVID policy decisions. And they also say that making mistakes is the best way to learn. And so I can tell you that I have at least 1,000 Stanford MBAs who will tell you that by that measure, I'm basically a world expert. But actually, that's not why I'm here. When I was invited to participate in this event a few months ago, it was with the understanding that the goal would be to bring together people with different perspectives and engage in a day of discussion, and in that way try to repair some of the rifts that opened during COVID. And that struck me as a valuable goal, and in fact, the sort of goal we should aim for at Stanford. And so I agreed to give a few remarks to that effect. And what followed over the last 2 months was actually was in many ways somewhat disappointing, because when I was invited, I asked around, and indeed the organizers were in discussions with a whole array of people with quite different views who were likely to speak, but it proved not so straightforward to execute on that agenda. Some of the invitees weren't able to make it. Some of them withdrew. Some of them didn't want to participate in an event with other speakers whose views or behaviors they claimed were attacking or abhorrent. And when the initial agenda, a partial agenda, was posted, it was immediately perceived as one-sided, and I'm sure you all noticed became the subject of op-eds and social media attacks. And in a sense that was ironic, because instead of repairing rifts as was intended and perhaps spurring some fresh thinking, that process seemed to reopen and revisit a lot of old and existing divisions. And as an observer and also as the leader of this university, I found that episode dispiriting. In a way that goes beyond the specifics of this particular event. We have many issues today at Stanford and on other campuses where views are divided, and in some cases like this one where feelings are raw. And I believe that we need to make every effort to get people who disagree, even sharply, in dialogue with one another. I think it's essential that we do that as members of the faculty and as university leaders. And that's not just because it's a way to advance knowledge, but because we need to model that behavior if we want to expect it from our students. And in today's world, we absolutely need to ask and expect our students to be able to engage with and listen to and debate with people with whom they disagree. So my view is that we need to err on the side of talking to each other, especially on a college campus. So I hope that today's conference is going to come up in a way that does involve just that it involves thoughtful and robust discussion across a whole range of different perspectives. I hope it yields some important insights about future pandemic policy. We certainly need that. And perhaps it does even bridge a few divides among those who are here in this room. And I hope even more that all of you will join me in the larger project of trying to make Stanford and other campuses forums for the type of thoughtful and robust debate that is really at the heart of universities when we're at our best. So thank you.
Thank you, President Levin, for that. Those were fantastic remarks. And thank you all again for coming. This is an important event because I think this is the first event where people of very different viewpoints about what happened during the pandemic are going to speak to each other in a way that's constructive, that fosters ideas about what went wrong, of course, in the past, but also, even more importantly, about what we can do better in the future. The pandemic, by any measure, was a terrible disaster. And I think has very widespread agreement, no matter what your views on managing the pandemic. Tens of millions of people are dead. Trillions of dollars have been spent. Our children have lost countless opportunities for learning. The poorest of the world have suffered in unimaginable ways. But the key thing about what went wrong, I mean, there's many that we can talk about. I just want to talk about a single thing that went wrong that I think that universities uniquely can do to contribute to the future of better management of pandemics. And that is to foster dialogue with one another. Rather than having a situation where the goal is to destroy people who disagree with you, what universities can do, and I hope in the future will do, universities like Stanford that I love so much, is to model the kind of dialogue that you're going to see today among people who differ very, very sharply on their views about what went wrong and what we ought to do next. And it's in the middle of that dialogue, I think, that where we start to understand what really we ought to be done, right? Because nobody has a monopoly on the truth. I've been at Stanford for 40 years, almost. Oh my God, 40 years. It's as a student, as a professor, and I love this place. But during the pandemic, I fell out of love some. It was a very tough place to be, a lonely place to be. But although there were some colleagues of mine that I admired who stood strong, it was a very difficult place. In December of 2020, the former president of Stanford, John Hennessy, invited me to participate in a dialogue with somebody who disagreed with me. But unfortunately, we were unable to find somebody who would agree to talk with me in December of 2020. In that sense, this conference is 4 years too late. But it's not too late, I say. I think that this is not the last pandemic we as a world will face. And it's in this kind of event, this kind of dialogue, the hit pieces aside, that really advances get made. It's in this kind of, it's almost an act of faith to come here. It's almost an act of faith to agree to participate in this dialogue. And it's the act of faith that we owe the citizens of the world as people who are privileged to work at a place like Stanford University. That is our very mission, is to hold these kinds of conversations when it is the most difficult. And this will be the beginning of that. I think this is the first public conference with a public audience that has, at a major university with experts representing such a wide range of views. The attacks on the conference early on were that we were very one-sided. I think you will see during the day that is not the case. In fact, there is a very, very wide range of views represented on every single panel. And there's, although I don't know if I agree with any single person on everything, other than maybe Sunatra Gupta, but we disagree on some things. But that's another matter. The panels you'll see, I hope to learn from every single panel member, including people that I disagreed with during the pandemic. The audience in attendance, you all, also many of you should be on the stage. I don't know what to say about that other than just to apologize. There's only so many shares you can have. But what you have in front of you are QR codes. If you have questions and comments or that you would like to see addressed, if you scan your phone on the QR code, you should be able to get to a page and you can type your comment or question in. I'm going to be sending those questions to the moderators. The goal of each of these conversations will be conversation, right? So each panelist will have 5 minutes to speak, and then we'll have a fantastic conversation. Your questions will get to the moderators, so they can see, and hopefully they'll have time to address it. We left a lot of time for exactly that conversation. I want to thank George Tidmarsh, and I want to thank the Collateral Global think tank and charity in the UK for supporting this conference. It was absolutely not possible without them. I want to thank Doug Owens in particular from the Department of Health Policy. He has just been an amazing, I've known Doug for, how long have we known each other, Doug? 30 years? But it's been amazing to watch him support this conference, even though times were hard to do this. And I'm tremendously grateful. And finally, I want to thank President Levin for agreeing to speak, and I want to thank those of you who are listening for listening. As I said, this is the way we move forward. I was asked to read a disruption policy. This is actually pretty good. I thought. Let me just read it. I didn't write this, but I did modify it just a tiny bit. We as a university recognize and value the rights of people to express their views, which is why we will not permit disruptions to this event. Freedom of speech is a core value at Stanford University. Those who engage in the disruption of the event will be issued a warning, and if the warning is not respected, may be asked to leave. The way we have freedom of speech, the way we have discussions is by having civil discussions on the most difficult topics. The conflict will come in the ideas, not in the expression of discontent or trying to disrupt events. Thank you, everybody, for coming, and thank you for your participation in the event. I want to introduce now Professor Laura Carstensen, my friend, who will be the MC and introducing the panels for the event. Thank you. Thank you all.
Thank you, Jay, and the organizers, President Levin. I am so proud to be part of this event today, proud of the Department of Health Policy of Stanford University for bringing so many people with very different positions together to have conversations about a really important topic. Science is a community endeavor, and Stanford is committed to civil discourse among people who disagree about vital issues. So we will hear today from people with a range of perspectives and try from hearing from them to extract lessons about how we respond to the next pandemic. It's time. I'm a psychologist, and so I can tell you that as a species, we are really uncomfortable with uncertainty. We grow frustrated when we have to make decisions without knowing fully what the information entails. And when the nature of evidence changes over time, it's incredibly difficult. And it's especially hard to appreciate the strain on public officials who are tasked with advising the public during the COVID pandemic. Now, physicians are used to making decisions under uncertainty. They do it often in medical practice, but they often do it jointly with a patient, one person, as they're just making decisions about how to proceed. This was different. This affected the globe. It affected countries, counties, states. The stakes were high, the economic and the social consequences enormous, and the possible outcomes include life and death. Our first session is called Evidence-Based Decision-Making During a Pandemic. And the moderator for this session is Wilk Wilkinson. Mr. Wilkinson made his way as a businessman and a citizen to Francis Collins in 2022, who was just stepped down as head of NIH and had played a major role in federal responses to the pandemic. Mr. Wilkinson was angry, and what happened next speaks volumes about him and Francis Collins. They became friends, and they created the Braver Angels Truth and Trust Project. I welcome Wilk Wilkinson and the panel for this first session. Thank you.